The newborn period is a critical time for infant feeding. During birth, the fetus transitions from a sterile environment into one that is populated by potentially disease-causing microbes. Because the newborn immune system is still immature, a baby relies heavily on her mother's immune system to detect and manufacture specific antibodies to pathogens in their shared environment. Without this passive immunity, a baby is significantly more likely to contract infections in the first 6 months. In many cases, the pathogens that cause these infections gain access to the baby by way of unsafe early feeding. Babies who are exposed to pathogens in contaminated water or unclean bottles are far more likely to get sick or die of diarrheal disease than exclusively breastfed babies.
As I know, coming from a poor environment, coming from the township, we don't always have the best resources, and that's even when it comes to water.
In parts of the world where the cost of formula feeding puts an economic strain on a family, many mothers will try to stretch the formula by using less than the recommended amount for each feed. This practice can lead to malnutrition, immune suppression, and an even greater risk of serious infection in the child. In some communities, babies are given other liquids or traditional medicines even before breastfeeding is initiated. This practice, called prelactal feeding, is especially dangerous because the baby has not yet received any of the protection offered by the antibodies in her mother's colostrum. The practice of introducing solid foods early in a child's life is sometimes believed to help babies sleep better or gain weight. But the early introduction of solid foods interferes with breastfeeding and raises a child's risk of developing nutrient deficiencies, infections, and chronic diseases. For these reasons, exclusive breastfeeding for the first 6 months is almost always the very best choice for feeding a healthy baby.